Imagine being pregnant and discovering you have a health condition you've never heard of. What would you do next? I'm talking about gestational diabetes, and it's more common than you think and could be happening to you. Hello? Welcome back to our channel. Today, we're diving into a crucial topic for expectant mothers: gestational diabetes. Whether you're pregnant, planning to be, or just curious, it's essential to understand this condition. Gestational diabetes is high blood sugar that develops during pregnancy and usually disappears after delivery. It can occur at any stage but is more common in the second or third trimester. In this video, we'll explore what gestational diabetes is, who's at risk, the symptoms to watch for, how it can affect your pregnancy, and the treatments available. So let's get started. What is gestational diabetes? Gestational diabetes occurs when your body cannot produce enough insulin, a hormone that helps control blood sugar levels, to meet the extra needs during pregnancy. This leads to high blood sugar levels, which can pose risks to you and your baby if not properly managed. However, with early detection and proper management, these risks can be significantly reduced. Who is at risk? Any woman can develop gestational diabetes, but certain factors increase your risk. Being over 40 years old, having a body mass index, BMI, over 30, having had a baby that weighed 4.5 kilograms or more at birth, having had gestational diabetes in a previous pregnancy, having a family history of diabetes, being of South Asian, Black, Afro-Caribbean, or Middle Eastern origin, having had gastric bypass surgery or other weight loss surgery. If any of these factors apply to you, your doctor will likely offer screening for gestational diabetes during your pregnancy. Gestational diabetes. Symptoms to watch. For gestational diabetes usually doesn't cause noticeable symptoms and is generally detected through routine screening. However, if blood sugar levels become very high, you may experience increased thirst, needing to urinate more often, dry mouth, fatigue, blurred vision, genital itching, or thrush. Remember, some of these symptoms are common during pregnancy and may not necessarily indicate gestational diabetes. Always consult your doctor if you have concerns. Impact of gestational diabetes on pregnancy. Most women with gestational diabetes have healthy pregnancies and healthy babies. However, gestational diabetes can lead to having larger than normal babies, which can cause complications during delivery. Too much amniotic fluid, increasing the risk of premature birth. You may have premature birth, preeclampsia, a condition characterized by high blood pressure, low blood sugar, or jaundice in the baby after birth. In rare cases, the baby may be stillborn. Gestational diabetes also increases the risk of the mother developing type 2 diabetes in the future. These are the most common complications for women who develop gestational diabetes during pregnancy. Screening and diagnosis of gestational diabetes. Screening for gestational diabetes usually occurs between 24 and 28 weeks of pregnancy with an oral glucose tolerance test, OGTT. If you had gestational diabetes before, you might be screened earlier. The test involves fasting overnight, having a blood test, drinking a glucose solution, and having another blood test 2 hours later to see how your body processes the sugar. Before we talk about the treatment and management of gestational diabetes, I want to share a video that can transform how you deal with diabetes. If you're tired of battling type 2 diabetes, facing constant blood sugar spikes, and relying on medications and insulin injections, you need to know about this surprising discovery. Imagine a tea discovered in a remote African tribe that can reverse type 2 diabetes in just a few weeks. For those living the frustration of following restrictive diets without seeing real results, this could be the hope you've been waiting for. The video link will be in the description of this video. So how do you treat and manage gestational diabetes? Managing gestational diabetes involves monitoring your blood sugar levels, making dietary changes, and increasing physical activity. Light activities like walking, swimming, and prenatal yoga can help. If these measures are not enough, medications or insulin injections may be necessary. You will also be closely monitored throughout your pregnancy to ensure you and your baby stay healthy. Gestational diabetes. Long-term effects in future pregnancies. Gestational diabetes usually goes away after birth, but it increases the risk of developing it again in future pregnancies and developing type 2 diabetes. Regular checkups and a healthy lifestyle can help manage these risks. Babies of mothers with gestational diabetes may also have a higher risk of developing diabetes or obesity later in life. If you had gestational diabetes and are planning another pregnancy, get a diabetes test first. If you have an unplanned pregnancy, inform your doctor immediately. Understanding gestational diabetes is vital for the health of both mother and baby. Early detection and proper management can lead to healthy pregnancies and happy outcomes. If you are at risk or have any concerns, talk to your doctor about screening and preventive measures. Thank you for watching. If you found this video helpful, like and subscribe for more health and wellness tips. Take care.